Hey everyone, welcome back for another deep dive.
Always a pleasure.
Today, we're going to be talking about revision hip surgery,
Okay.
specifically acetabular reconstruction with a hemispherical shell and modular porous metal augments.
Sounds good.
We're going to be taking a look at a really cool editorial from the Journal of Arthroplasty by Sanghavi,
Oh, yeah.
Poprosky, and Shaith.
I know this one.
It basically goes into detail about when to place the augment before the cup
Okay.
and when to place it after the cup.
Augment first versus augment second?
Yeah, so before we kind of get into that debate, I think it's important to lay some groundwork.
Sure.
So, we're talking about cementless fixation here. Can you break down why that's so important?
Absolutely in revision surgery. So cementless fixation relies on intimate host bone contact and minimal micromotion for biological fixation.
Yeah.
That means you need good contact between the bone and the implant.
Right.
And very little movement at that interface.
Okay.
This allows the bone to actually grow onto the implant and make it a part of the skeleton.
So it's not just filling the space. It's actually becoming one with the bone.
Exactly.
That's incredible.
Yeah, it's a really cool process.
Now, I remember from anatomy class that the acetabulum, it's not just a flat surface.
Right.
There are these important structural columns
You're absolutely correct.
that support the joint.
Yeah, and that's where the Poprosky classification comes in.
Okay.
It's a way to assess the amount of bone loss in the acetabulum.
Okay.
So type 1 defects have minimal bone loss,
Okay.
whereas type 3 defects have significant loss of those structural columns.
Gotcha. So depending on the amount of bone loss,
Right.
the surgeon has to decide how to rebuild that foundation.
Exactly.
And that brings us to our metal augments.
Yes, they're like building blocks.
So they're not just fillers.
Yeah.
Then they have specific function
You got it.
that determine when and how they're used.
Precisely.
Okay. I'm really interested now, what are those functions?
So the first one is to provide primary stability. If those structural columns are damaged, the augments can be used to rebuild them and create a stable base for the cup.
It's like putting up support beams before you build a house.
Yeah, that's a good analogy.
You need that strong base to make sure everything stays in place.
Exactly.
So stability, that's one.
The second function is intracavitary reduction.
Okay.
This is important when there's limited space in the acetabulum.
Right.
If you try to put a big cup into a small space, you're going to have to remove more bone.
Right. You don't want to remove healthy bone if you don't have to.
Exactly. So placing an augment first can actually help reduce the size of the cup needed.
Wow. So it's like a space-saving technique.
Pretty much.
I like it.
Yeah.
So we've got stability, we've got reduction.
Mm-hmm.
What's the third function?
The third function is supplemental fixation.
Oh, okay.
This is where the augment provides extra support
I see.
to the cup that's already been implanted.
Okay, so like if there's not enough bone for the screws to grip properly,
That's right.
or if there's a weak spot,
Yeah, exactly.
then you'd use supplemental fixation.
Think of it like a flying buttress.
Okay.
It supports the cup and prevents it from moving or tilting.
Wow, that's a great analogy.
And in these cases, screw fixation is really important too.
Makes sense.
You want to make sure those screws are anchored in good bone.
To make sure everything stays put.
Exactly.
So we've been talking a lot about augment first.
Yeah.
When would a surgeon choose augment second?
Augment second is really useful for posterosuperior defects,
Okay.
which means bone loss in the back and upper part of the socket.
I see.
This area can be weak.
Uh-huh.
So placing an augment after the cup provides extra reinforcement.
It's like reinforcing a weak spot in a wall.
That's a good way to put it.
So the surgeon has to really assess the situation.
Definitely, it's a complex decision.
They have to consider the bone loss, the quality of the bone,
Right.
the patient's overall health.
And their activity level.
It's like a puzzle.
Yeah, it really is.
Speaking of puzzles,
Yeah.
what about those Poprosky type 2C defects?
Ah!
You mentioned those earlier.
They involve bone loss in the medial wall of the acetabulum.
Like an inward dent.
Exactly.
How do surgeons deal with that?
Well, one option is to use a special concave augment
Okay.
that fits into the defect.
So it fills in the dent.
Yeah, and creates a level surface.
I got it.
So once you have that base, whether it's created with augment first or augment second,
Uh-huh.
you need to secure it properly.
And that's where cement comes in.
Cement is key,
It holds everything together.
especially the augment to the cup.
So it creates one solid unit,
Exactly, and it helps prevent metal debris.
which is really important for the long-term health of the implant.
Absolutely.
It's like the unsung hero of revision hip surgery.
I like that.
So we've talked about cementless fixation.
We've talked about the Poprosky classification.
The different types of augments.
Augment first versus augment second.
And the importance of cement.
It's been a great discussion.
Now, I'm curious, with all these advances in technology, where do you see the future of revision hip surgery heading?
I think the future is really exciting. We're seeing a lot of cool stuff with personalized medicine and 3D printing.
Ooh, 3D printing.
Yeah.
Like in the movies.
Yeah, kind of like that. So we can use imaging to create a 3D model of the patient's hip.
Okay.
And then we can design an augment that fits perfectly.
Oh, wow.
Yeah, and that helps with support and bone growth.
Like a custom-made suit.
Exactly.
For your bones.
Pretty much.
So cool.
And then there's robotics and AI.
Whoa, now we're getting really futuristic.
I know, right? So robotics can help surgeons be more precise.
Okay.
Which is important in revisions because the anatomy can be tricky, and AI can help us predict outcomes and personalized treatments.
It's like having a superpower.
Yeah.
So for our listeners who are maybe facing a revision surgery,
right.
What are some key takeaways?
Well, the most important thing to remember is that every case is different.
Okay.
There's no one-size-fits-all approach. You need to find a surgeon who listens to you and understands your needs.
And who knows about all these options.
Exactly. Those augments are really powerful tools.
Right.
They can rebuild stability,
Yeah.
reduce the need for big cups, and provide extra support.
3 key functions.
Primary stability,
Yep.
intracavitary reduction, and supplemental fixation.
Got it.
And of course, don't forget about cement.
Cement, the glue that holds it all together.
Exactly.
It's amazing how all these techniques have evolved.
It really is.
It's giving people their lives back.
Yeah, it's pretty incredible.
So what do you think the future holds?
I think we're going to see even more personalized treatments.
Okay.
More advanced materials, and even better outcomes.
I'm excited to see it happen.
Me too.
Well, this has been a fascinating deep dive.
It has.
We've learned so much about acetabular reconstruction.
We've covered a lot of ground.
Cementless fixation, the Poprosky classification, those awesome modular augments.
It's been a great discussion.
And a glimpse into the future.
The future is bright.
For anyone out there facing a hip revision.
Or just interested in learning more.
Remember, knowledge is power.
Do your research, ask questions.
Find a surgeon you trust.
You got it.
Thank you for joining us on the deep dive.
It's been a pleasure.
We'll see you next time for another exciting exploration of orthopedics.